Okay, so yes. Hey, shall we start? Yeah. So good afternoon. My name is Qianying Lin. I'm gonna present these topics, but first of all, there's a few things that I should tell all of you guys. So during the presenting, everyone except me will have their microphone or camera turned off. And if you have questions or comments on my presentation, please enter it into the Q&A section at the bottom of the screen, and I will answer the questions once I'm done with the slides and we get into the Q&A section. So a copy of the slides will be sent after the presentation. A copy of the recording with captions will be available in our website in a week or so. So if you want an uncaptioned version, please reply to the email with the slides and just let us know. The information about this webinar, including what to do if there is a technical issue, links to publications, etc., can be found on the MIDAS website. That is midas.umich.edu on the calendar under events. So yeah, so if everything like everybody's okay, so I will just start. So hi everybody, like good afternoon. Welcome to this webinar. It's my first time doing this. So yeah, this topic is coronavirus 19 outbreak in Wuhan, China, because I'm from China, in retrospect and in prospect. So first of all, I will give a little bit like background introduction of myself. Right now, I'm a data science fellow of Michigan Institute for Data Science at University of Michigan, Ann Arbor. And before joining this position, I gained my PhD degree in applied mathematics at Hong Kong Polytechnic University last year. And my research interest focus on mathematical epidemiology, including various kind of infectious diseases, including influenza, MERS, coronavirus, HIV, etc. And also, I studied some human factors, the impacts on epidemics and the chain and the trends. So here is the outline of this presentation. First of all, I will give an introduction on the coronavirus infectious disease and reviewed on the epidemics in Wuhan, China, and also the government's actions. And then I will give a basic concept in epidemiology for better understanding of this study or our mathematical models. And then I'll talk about two of my previous publications on like reporting rates and R-naught that I would explain a little bit later. And then also the impact of governmental actions and individual, which is closely related to the situation right now in United States. And last is the Q&A section, which maybe like 10 or 15 minutes. So here is a simple introduction on the virus for all of you to understand, have some knowledge on the viruses. It's first confirmed in December 2019 in Wuhan, China. It's a novel coronavirus, which means at the very beginnings, no one knows things about this, like everything is unknown and is genetically close to the other two, the previous coronavirus, which are SARS in Hong Kong in 2003, and the Middle East Respiratory Syndrome coronavirus, basically in Saudi Arabia in 2015. And this virus would cause pneumonia, and the symptoms of infection is non-specific. It could be cough, fever, shortness of breath, diarrhea, swollen eyes, etc. So it could be transmitted through respiratory droplets, through contacts with other people, especially with infected individuals. And until now, the intermediate host is still unknown. And as of today, there are over 81,000 confirmations, and with over 3,000 deaths in China. So there are ongoing major outbreaks in Italy, Iran, and South Korea. The outbreaks in United States right now are at a very early stage. Although, like as of today's, just 3 minutes ago, there are 1,919 confirmations, with 12 confirmation in Michigan, with 41 deaths in the United States. So before we go deep into the research, I'll give a brief review of the events and actions taken by the government in Wuhan throughout these outbreaks in China. So the first hospital admissions in Wuhan was on December 16th, although the first confirmation can be dated back to December 1st, 2019, which was not related to the seafood market that is reported to be the so-called source of the outbreaks. And then the seafood market shut down on January 1st, 2020, and then the genome sequences of the novel coronavirus released on January 12th. And there's a first household human-to-human transmission confirmed in Guangdong province in China. Before that, it was reported that the transmission between humans were limited. So on January 23rd, the Wuhan government shut down the public transportation, and then they shut down the whole province, the Hubei province publication, and also the government banned all cars in downtown. And on February 11th, WHO officially named the disease caused by the novel coronavirus as coronavirus infectious disease 2019. So the reason why I go through these reviews of the events and action, because one of my focus in the studies was to model the trends of the outbreaks, incorporating some human factors, including individual response to the outbreaks and also governmental actions. So here are some basic concepts in epidemiology in case someone may be unfamiliar with that. These are very crucial concepts. So let's go to the primary case first. The whole duration of infections, which is from the start of infection and so-called the end of the infection, can be divided into different periods. So the first category is we divide it into latent period, which is from the start of the infection to the start of infectionist, which means this patient have the ability to spread the disease to infect other people after that. And then from the start of the infectionist to the end of infectionist, that is so-called the infectious periods. So during these periods, this primary case can infect other peoples, which can be the secondary case. And by the end of the infectionist, then is the end of infection. So The second way to divide this whole duration of infection is from the start of infection to the start of onset of the symptoms, which is called the incubation period. So by comparing the latent period and the incubation periods, we can see that these individuals can spread the disease even before the symptoms appears. So from the onset of the symptoms, we have the end of the symptoms and then the end of the infections. So there are two concepts defined by these periods. One is called the generation time, which is the time intervals between the primary infection and the secondary infection. And another one, which is equal to the generation time in values, is called the critical onset severe intervals, so which you can find everywhere. It is defined as the onset of the symptoms in the primary case to the onset of the symptoms in the secondary case. So these two concepts, these two time intervals are equals in values, but obviously the zero interval could be much more observable. And then from previous literatures, the median incubation periods of coronaviruses 2019 is about 5.1 days, and reported by the news, it could be as long as 40 days. That's why people would suggest 40 days self-isolation before when you contacted with infected individuals. So another important or maybe well-known concept is called R0 or R0, like the basic reproduction number. So it is the expected number of secondary cases infected by one primary infection in a pure susceptible population. What is a pure susceptible population? Which means that these people are healthy and not immune, not protected by vaccine or maybe by others antibodies. So when these properties, when R0 is less than 1, the disease would die out in the long run. Otherwise, it would probably spread across the population. So this is a very critical property to evaluate the contagiousness and the severity or contagiousness of the infectious diseases and the severities of the epidemics. So here I share some information on the severe intervals and naught of other diseases. So for example, measles is high contagious and very severe disease, which has severe intervals of 10 to 13 days and R0 of 12 to 18. And MERS in human has severe intervals of 6 to 7.8 days and R0 of 0.3 to 0.8. I emphasize humans because it's reported that there's very limited transmission between humans. The outbreaks was due to the zoonotic, like that is the camel to human transmissions. So one thing that I should emphasize is the influenza, like the Spanish pandemic in 1918 has severe intervals of 2 to 4 days and R0 2 to 3. So please remember these two quantities. I would compare it with the coronaviruses because they are both pandemics right now. So my previous publication, like my first publication, mainly focused on estimating R0, the basic reproduction number of coronavirus coronavirus disease 2019 in Wuhan. So I highlight the key components that we used to estimate the R0, which is first the growth rate. We assume that the cases increase exponentially when like one individual could infect more than two, the cases would grow exponentially. And then that is the severe interval that I mentioned before. So it's because it differs from people to people, so we assume that it follows a distribution. And the third one is the reporting rate, which is a pretty crucial factors here in both in modeling the epidemics or estimating the R0. That is the ratio of reported confirmations over the actual infections. So when reporting rate is 100%, which means is perfectly correct in reported the new cases. But when it's lower than 100%, there's some underreported cases that is like potential cases that can spread the disease on overreported, which means that it is larger than 100%. It can be due to the previous underreported cases. So we use this formula to estimate the R0. So here are some results. So I showed this figure in order to mention that the reporting rate is pretty crucial in estimating the basic reproduction number. So actually we assume different reporting ratios increments, and these two are the extremely cases here. So first of all, from the first row, we assume 100% reporting rate all the time. There is no underreported, no overreported. Every cases are correctly reported. So here is the figure in the middle is the daily new cases. Blue dot is the so-called adjusted cases. Green circle is the reported cases. They match perfectly. Then we can use the curve and the formula I mentioned before to estimate the basic reproduction number as 5.71 with a 95% confidence interval as 4.24 to 7.54. And then in the second row, we assume a 8-fold increment, which means that at the beginning of the outbreaks, that is only 12.5% reported rate, and then it increased gradually to the end to peak at 100% on January 21st. So from the middle figures, we can see that daily new cases. The first one is about 41 cases, is underreported. The actual number here is times 8, is 8 times of the reported cases, which is over 300 here. And then this one is 0 cases. And from here, we increase the reporting rate, and then on January 21st is 100%. So here is the figure of cumulative cases. Then using this increment of reporting rate. So we have these blue dots here. We use this so-called adjusted actual infections to estimate the basic reproduction number. So we can estimate the R0 at 2.24 with a 95% confidence interval, 1.96 to 2.55. So these two examples shows that the reporting rate is very, very important in estimating the basic reproduction number, which is a critical property on evaluating the contagiousness and severity of the epidemics. So as we all know that at the beginning, because nobody is familiar with this virus, everybody knew nothing about the virus, and is due to various factors, for example, lack of the toolkits to testing the results, or like people are not aware of these diseases, so there will be many underreporting here. So, but when the public aware of this disease, the reporting rate will increase. So the reporting rate is not a constant; it varying through time. So here is the main conclusion here. The changing reporting rate over time had a great impact on estimation of the basic reproduction number, R naught, as I showed before. So the underreported could make an overestimation of the basic reproduction number. Also, the estimation of R naught dropped from 5.7 to 2.24 when we adopt different ranges of increment in reporting rates. So one of our publications actually estimates the reporting rate can be as low as 5% at the beginning, and with that result, we estimate the R naught at 2.56 with a 95% confidence interval of 2.49 to 2.63. So next, we should talk about the relations between the coronavirus disease 2019 and the 1918 influenza pandemic. So they share a lot of similarities here. For example, they have a very similar R naught, which is 2 to 3, suggested by the WHO actually. So, and they have a relatively short mean severe intervals. For example, coronavirus have around 4 to 5 days, and influenza have 3.6 days. So here I highlighted the 4 to 5 days. If you guys remember, I mentioned that the mean incubation period of the coronavirus is about 5.1 days. So a relatively short severe interval with a relatively long incubation period could actually imply asymptomatic transmission. That is, like patient can infect other people even before the symptoms appears, which is a pretty crucial properties of these viruses here. Then they also have shared a relatively low fatality rate, is around 2%, and also they have a significant proportion of deaths due to pneumonia after infection. So with this all these similarities between these two pandemics, we can refer some properties of the 1918 Spanish pandemic to model the dynamics right now in Wuhan, China, or maybe around the world. So first, I would introduce the epidemiological compartmental models. So basically, here a briefing here. Basically, this model is like divide the whole population into different classes, which is different stages of infection. And then we assume the rates of transition between these classes or interactions between these classes. And we modeled these transitions, the size of these classes in an ordinary differential equations. So by these definitions, it seems that it's very, very flexible because we can divide the classes as detailed as we want. as long as we have the rates of transmission between them. So it could be very complicated and very realistic to the data. And then let me introduce the conceptual model for the coronavirus 2019 outbreaks in Wuhan that we used in our paper just published. And then there's a few assumptions we make for the models for better fitting, or not better fitting, for better for more realistic and also like much easier to understand. So first we have the zoonotic, that is the human animal to human transmission at the first month, because we have about 41 cases that at the very beginning. So then we assume that this first 41 cases are due to animal to human infections, and after that, all infections were caused by human to human transmission. And then, because the outbreaks is during the periods of Chinese New Year, so everybody is rushing for their rushing to go back to their hometown. So there would be around 5 million people left Wuhan from December 31st, 2019 to January 22nd, 2020. So the whole population in Wuhan city is 14 million, which means that the outbreaks after the cities was shut down, was locked down, there are only 9 million people stayed at the city. So also we assume that 10% of the populations are not susceptible to the coronaviruses, because from previous reports, the infective rate among children, especially around children under 15, is pretty low. So we assume that children is not that susceptible to the virus than adults or than elderly people. So here, two components are not included here due to limited knowledge. For example, we do not include the asymptomatic transmission because right now we do not know the proportion, like how large is the proportion of the population could have the asymptomatic transmission. And also we did not include the temperature because the impact of the temperature on the outbreaks was still unknown. So here is a detailed explanation on the model. I know this is a little bit dense and too much information, but it's very crucial. So please pay a little bit attention to this. So as I previously mentioned, the compartmental models divided the whole population into different classes or different stages. For example, in this model is a very basic and classic SEIR model framework. For example, this population was divided into susceptible as E is the exposed or latent, which is infected but not infectious, and I is infectious. That portion of population can have the ability to spread the disease, and R is for recover or remove, sometimes like just eliminated from the population by isolated, quarantine, etc. So F here, as I mentioned, we include the zoonotic introduction, the previous 41 cases, and then C here represent the daily number of severe cases. So it also represents the perception of risk, like of risks regarding the severity of the epidemics, which play a crucial crucial role in human response, human behavioral response towards the diseases, because you know, when you find out the number is pretty high, for example, the number of deaths is pretty high, you could be very cautious about your daily life. For example, frequent hand washing, and maybe keep some distance when contacting with people. And see here is the number of all infections, including the reported or unreported. That's how we include the underreporting, the changing underreporting ratios here. And for beta 0 is the initial transmission between SNI, like before the government's action, before everybody know the virus and have some response to it. And beta T is the time varying transmission rate. It is changing due to the governmental action, due to the individual response that I would explain it in detail in the next slides, that how we model this change in transmission rate. So others parameters is like the inverse sigma is the latent periods in days, and inverse gamma is the infection periods in day. And also because 5 million people left Wuhan before the lockdown of the city, so we have the immigration rate here, and we have the rate of severe cases and decay of the perception, which means that people is really easy to forget about the severity of the diseases, so just lose their cautions, I guess. So in this slide, I would explain how we model the governmental action and individual reaction and incorporate them into the time varying transmission. So N is the total population in Wuhan. It starts from 14 billion and then drop to 9 million after the lockdown of the city. And then D, as I explained previously, is the daily number of severe cases, like also represent the perception of risk on the virus, on the virus. And alpha here, we call it the strength of governmental action. So, and kappa here represent the intensity of individual reaction. So these three components here could build up the whole time varying transmission. So 1 minus alpha, which means which includes the reduction of transmission rates by governmental action. For example, governmental action including transportation shutdown and quarantine, and also hospitalizations, isolation, etc. And this individual reaction includes hand washing, like decreasing contacts with people, for example, also and represent a reduction of transmission rate by personal reaction to the proportion of the severe cases. So right now we go into the findings of this paper. So from figure A, we have the daily new infections with a reporting delay, which we assumed as a 40 days of reporting delay. And here, please pay attention to the y-axis here is in log 10. Is in log 10. So the axis is a little bit like not realistic, but I will explain why. So then we have the gray dotted line here, with represents the reported cases. So we have assumed 3 scenarios here. One is called naive, which means the government did nothing to control the diseases, as well as the individuals did nothing to prevent infections. So you see that if everybody did nothing, it will go up as a peak at over over 100,000 cases one day. That is a daily new infections. So the second scenario here is we only include the individual reaction, which means only depends on individuals to wash their hands, canceling gathering, decrease contact with other people. So it will become about 10,000 a day here and like keep for a long time. And once we include both factors, which is the individual reaction and also the governmental action here, which is the green light, you can see it's a very effective control here, drop fastly, and by the end of April, the epidemics will be totally controlled. So all the parameters are referenced from a previous paper on 1918 influenza epidemics and other like official news releases. So in figure B, we also calculated the reported rate here. So reported rate means the green line, the number of so the number in gray dotted line over the number in green line here. So at the very beginning, at early January here, the reporting rate is very low, and then it jumped a little bit and to about 50% in early February. So it shows that the reporting rate is exactly time changing. And some of you may ask that how about like this over 200% reporting cases here? Because it's due to the underreported cases in the early stage. So the government like just assigned examination on the previous cases. So that's why it have an overestimated condition here. We also did some sensitivities on the governmental actions, which is alpha, the strength of the governmental action, and also the individual reactions controlled by kappa. So from figure A also is daily new infection with a reporting delay in log 10. We use different strengths here from weak to strong. You may see that it's a very, very effective way to control or maybe end the outbreaks with a strong governmental action, for example, shut down the transportation, shut down the school, etc. And then in the second figures here, in figure B, we also use a weak intensities of individual response to a strong intensity here, and we find out that it helps to control and it helps to accelerate the control at the end of the outbreaks with under a very strong governmental actions. So the second part conclusion here is the outbreak in Wuhan would be completely controlled by the end of April under current policies and restrictions. Second, the reporting rate is time varying. At the beginning, in early January, it was below 10%, and then increased to around 15% in early February. And individual caution in daily life helps to reduce the transmission and accelerates the end of the outbreaks. Governmental actions, for example, holiday extension, travel restriction, quarantine, etc., are very effective means to control and end the outbreaks. So last right now some discussion here. So since United States is actually at its very, very beginning of the outbreaks, United States is actually here at the very beginning of the outbreaks by comparing to stages of other countries. For example, right, China is at the end, almost end the outbreaks here. South Korea, Japan, and Singapore, and United States is only at the beginning stages. So should the government of United States should do the same thing? What kind of factors we should consider to make political decisions? So, in my opinion, there are some factors including population density, age structure, because I mentioned that young people or maybe young children are less susceptible to the disease than older people. So also the transportation patterns, because the outbreaks in Wuhan, Wuhan is actually the central of the highway train in China. So hundreds of thousands of travelers, passengers would go to Wuhan and transfer to other cities every day. Also, the individual reaction here. For example, in South Korea, once the government announced the outbreaks, everybody just like on the streets, nobody on the street, and everybody was wearing masks, and do a very frequent hand washing. So these factors we should consider, but I should emphasize that governmental action would be very, very effective tool. Effective means to control and end the outbreaks. So here is the references that I mentioned or that I use for the parameters. Okay, thank you for you guys. So here we can have the Q&A sections. Or if you want further questions, like in detailed discussion, you can just email me after the presentation. Thank you guys for your coming.
All right, and this is James Walsh here. I'm administrative support here at Midas. I'm going to be helping with the Q&A. So we're just going to take a second to read through some of the questions that have come through during the presentation. And then I will read those out loud and try to answer as many as we can in the time that we have left. So, all right. So we'll start with the first one that came through. So first question we had today was, why would we not allow young, healthy individuals to interact with one another in the community in order to allow for transmission of COVID-19 within this low-risk population, which would then generate herd immunity, therefore protecting the community at large?
Okay, so the question here is we do not really understand the mechanics of the disease, so it would be very risky to just allow so-called young individuals, because sometimes young individuals can have a very severe symptoms after infected. So I would say it's very risky. It's very risky here to just allow them to contact. Yeah.
More that have come through here.
Yeah, this one.
This one? Cool. All right, so next question. Is the mortality rate of COVID-19 likely substantially different than statistics being published by the World Health Organization and the Center for Disease Control? For example, data from South Korea, where population-based testing is being conducted, appear quite different from data in places where just symptomatic individuals are being tested.
Yeah, I would say, of course, because for country who only tested symptomatic infections, so which means in my opinion, there is a lot of underreported rates here, right? You do not know this asymptomatic. And actually, for the asymptomatic transmission, we do not know whether these individuals are asymptomatic or pre-symptomatic, which means that the symptom just not appear yet, and maybe appear later. So the fatality rate would be huge difference. And also, South Korea government did a really great job in controlling the outbreaks. So it's a different stories in South Korea, because the outbreaks in South Korea is due to super infections event. A patient that belongs to religious groups, they just wandering around, and also the group members wandering around, and there is a major outbreaks in one of the cities with a relatively dense population. So, and after that, the South Korea government immediately locked down the religious facilities, and also have a very restrict testing or examination or quarantine to everybody, and the public in South Korea very cautious about the outbreaks, so they did a very good controlling measures to stop or to end, or maybe to stop the disease. Actually, South Korea is almost at the end of the outbreaks. Yes.
Answering some of the questions that we can handle in here. So we'll look through some of the next ones coming through.
I do not know. So skip.
Sure. Okay. So
yeah.
There, I'll let you. Okay. So what is the risk of reemergence of epidemic in Wuhan after a complete control has been achieved by the end of April?
So I would say the re-emergence actually is most of the cases in China or maybe in Wuhan right now are actually imported cases from other countries, for example, from Italy or maybe from Iran. So the risk of re-emergence would totally depends on the testing or the quarantine at the airport. So right now, I would say the risk is very, very low, because Chinese government did a pretty great job to surveillance or testing the incoming travelers right now. Answer for yes.
So
yeah.
From Aaron King, you've effectively used the data on the time course of the epidemic in Wuhan to infer the effectiveness of the government and popular response. With more data on the spread of the disease to other localities within China, can you test these inferences?
Yes, I mean, with more data, including the transportation data, like how many passengers go and leave Wuhan every day to other locations in China, or and the population densities, and also because the government action varies in different locations, we could test it and use statistical inference methods to test this data, and also compare the strengths or compare intensities, the strengths of government actions, and also the intensities of individual response, and in different locations in within China, or even like in other countries. So answer yes.
Sure. So from Paul Frankel, we have many thanks for this important discussion. Would you say that the serial interval and the R naught are very similar to the flu of 1918? It seems that the main difference is the higher fatality rate of COVID-19.
Yes, I would say that. But another major difference between pandemic 1918 and COVID-19 2019 is the COVID have a suspected or maybe some proportion of asymptomatic transmission. So we are not clear about that part, and also like accompanying the incubation periods could be as long as 14 days. So that's why, because due to this asymptomatic transmission here, that's why I would say the prompt and also in-time measure taken by the government would be very crucial and critical to decrease the number of infection, or even stop, or even like end these outbreaks. And the fertility rate, it actually depends on many other factors, because as far as I know, the fertility rate in South Korea is very, very low. It's under 1%, but in China is about 2%, and also in United States is about 3%, because the major outbreaks in Seattle is around elderly people. So yeah. I don't know actually.
I think it looks like our Q&A has slowed down just a little bit here. If we weren't able to get to your question, it's either just kind of like out of the scope of what we're working with, or there may just not have been enough time to prepare an answer. So I think at this point we will wrap things up.
And thank you all for coming to this webinar. Thank you so much.